current coronavirus outbreak has dominated the news cycle since late 2019. The outbreak involves a new type of contagious virus for which there is, as of yet, no vaccine. The new virus has been named SARS-CoV-2, and the disease it causes is called COVID-19, which stands for Coronavirus Disease 2019. Like many others, you may be concerned about this new virus outbreak and its possible effects on public health, globally, locally, and personally. This course is designed to give a brief overview of the rise and spread of COVID-19. We will describe the symptoms and risk factors, discuss what you can do to help reduce your chances of becoming infected, and identify where to find reliable, up-to-the-minute news and information about the COVID-19 outbreak. At the end of the course, you'll have a chance to test what you've learned with a short quiz. So, if you're ready, let's begin. Coronaviruses are a large and common family of viruses that can occur in animals and in humans. Most of us get infected with coronaviruses at some time in our lives. They usually cause mild to moderate upper respiratory infections, resulting in symptoms much like those of the common cold, but they can also cause more severe illnesses, such as bronchitis or pneumonia. In addition to the more common coronaviruses that affect humans, sometimes a new variety of coronavirus can develop in animals and then cross over to humans. Past examples of this include the coronaviruses that cause SARS, the Severe Acute Respiratory Syndrome of 2003, and MERS, a Middle East Respiratory Syndrome first reported in 2012. The most recent coronavirus of this kind, SARS-CoV-2, was discovered in Wuhan, China in December 2019. And as we mentioned earlier, this is the virus that causes COVID-19. COVID-19 spreads from person to person like other respiratory viruses, through small droplets of saliva or mucus, which can be expelled when coughing, sneezing, or just exhaling. These droplets land on nearby objects and surfaces. If another person comes into contact with the expelled droplets and then touches their own eyes, nose, or mouth, they can become infected with the virus. The droplets can also be passed during close personal contact, as when touching or shaking hands with someone. And if you're close enough to a person with COVID-19, within about 3 feet, you could also breathe in droplets that the person exhales or coughs out. Symptoms of COVID-19, which usually show up between 2 and 14 days after infection, can range from mild to severe. Typical symptoms include fever, tiredness, and dry cough. Some patients also report achiness, congestion, runny nose, sore throat, and diarrhea. Symptoms are usually mild and begin gradually. It's also possible for people to be infected with COVID-19 without developing symptoms or feeling unwell. Most people who contract COVID-19 recover without the need for special treatment. A small percentage of people with COVID-19 become seriously ill and can develop difficulty breathing. An even smaller percentage die from the disease. While everyone is assumed to be susceptible to contracting COVID-19 if they're exposed to the virus, the World Health Organization, or WHO, reports that those at greatest risk for developing a severe or lethal case of the disease are those over 60 years old, and those with underlying conditions such as hypertension, diabetes, cardiovascular disease, chronic respiratory disease, and cancer. Among children, the disease appears to be relatively rare and mild. The response to the outbreak of COVID-19 has included efforts to isolate affected groups and contain the spread of the disease, as well as extensive study and research focused on understanding this new virus and developing medical therapies or vaccines to combat it. The WHO recommends these strategies to help lower your risk of contracting COVID-19. Clean your hands regularly with an alcohol-based sanitizer or wash them thoroughly with soap and water. This will help reduce your risk of transferring the virus from contaminated surfaces or sick people to your own eyes, nose, or mouth. Regularly clean surfaces, such as kitchen tables, chairs, countertops, and work surfaces with disinfectant. Learn about COVID-19 from reliable sources, including your local or national public health agencies, the WHO website, or your own healthcare provider. Know the symptoms. It usually begins with a fever and a dry cough, not a runny nose. Most people will have mild symptoms and get better without needing any special care. Avoid traveling if you have a fever or cough. If you become sick during a flight, inform the crew. Once you get home, contact a health professional and tell them about where you've been. Cough or sneeze into your sleeve or use a tissue. Dispose of the tissue immediately into a closed trash can and then wash your hands. If you're over 60, or if you have an underlying condition such as cardiovascular disease or diabetes, you have a higher risk of developing severe disease. You may wish to avoid crowded areas or places where you could interact with people who are sick. If you feel unwell, stay at home and call your doctor or local health professional to discuss your symptoms, where you have been, and whom you've been in contact with. If you're sick, stay at home and eat and sleep separately from your family. Use different utensils to eat. If you develop shortness of breath, call your doctor and seek care immediately. It's normal and understandable to feel anxious, especially if you live in a state or community that has been affected by the COVID-19 virus. Learn what you can do in your community. Discuss how to stay safe with others in your workplace, school, or place of worship. To find comprehensive and authoritative news, updates, research, and recommendations concerning COVID-19, visit the websites for the WHO and the U.S. Centers for Disease Control and Prevention.
I recognize the video that we just watched. It's probably information that you already knew related to the coronavirus. However, I thought it'd be very important for all of us to have the same level of information, getting our information from the same place. I found that video extremely helpful as I was watching the Safe School trainings for Campbell County. And so thought that I would share that with you wherever you are at so that you know, and we have a consistent basis of training related to coronavirus awareness. Now, before we get into our expectations of you as a volunteer, I need to say this related to the coronavirus and the precautions that we are taking and the guidelines that we are following. I know that this time has created a lot of division in our world, and people's opinions related to the pandemic, coronavirus, and how we should move forward and operate is all over the place. And chances are, if you are listening, you're on that spectrum somewhere. Maybe you think it's overblown, or maybe you're still kind of really hesitant and have a lot of maybe anxiety about what's going on, and you're maybe even reluctant to come back and volunteer with us quite yet. Let me say this regarding how we as a church are going to respond to this. We're going to set human opinion aside, and we're going to look to God's Word and to the absolute truth of God Himself to figure out how we should move forward and operate. And when we look into God's Word, what we are taught, according to Romans 13, is that we are to submit to our governing authorities. Matter of fact, I think about Jesus Himself. If you remember the prophecy from Isaiah, it says this, the prophet Isaiah prophesied about Jesus, that the Messiah would come, and then it says, and the government would be upon His shoulders. Think about this for a second. Jesus is God. And we're taught in Romans 13 that God is actually the authority that gives these people and governments their authority. And yet when God became man, Jesus, He subjected Himself to the governing authorities, even though He Himself had authority over them. And so if you and I as followers of Christ are going to be followers of Christ, we need to follow His example. And so we're going to submit to our governing authorities. And so that is why we are being diligent to take and follow every guideline that the state and federal government has given places of worship, daycares, and schools. Why daycares and schools when it comes to kids ministry? That's what our governing authorities asked us to do. And so we are constantly looking and keeping updated on the new changes that are coming with daycares and with schools. We're looking at that related to places of worship. But as far as it concerns our church and our ministry, we are going to be obedient to our governing authorities. And so that means we're going to follow guidelines. And I recognize there's a lot of, again, opinions about that, of whether there's government overreach and all this. And let me just say this. Wearing a mask does not keep us from worshiping our God. There's nothing standing in the way from us worshiping our God and living out our faith. And so we're going to do that. We're going to still do that. And we're still going to do all the things that our governing authorities ask us to do, because that's what we as followers of Christ are called to. Not because we're trying to be good citizens, because we're trying to be good American citizens, because we're trying to be good Christ followers, and this is what Christ asks us to do. And so here's some things that we're asking of you as a volunteer. One is grace. We're asking you to be gracious with us. Leading through this time is a lot. There's a lot of changes. Things are constantly, every day. Even since we have done trainings and and now creating these training videos, things have changed that I'm having to change guidelines on. So things are changing all the time. And so I ask that you just be gracious with us and recognize when it comes to our heart, we want to live for God. We care about kids, and we want to do our best to create a safe, fun, and biblically relevant experience for kids, while leading kids to a life-changing relationship with Jesus Christ and partnering with parents to impact the next generation. But we're also not going to compromise our living out of God's Word. So know that that is our heartbeat of making decisions, and I ask that you be gracious with us as we navigate this tough time. I also ask for flexibility, that you be flexible with us and recognize things may be 1 month when you show up, they may be one way. The next month when you come to serve, things may be a little different. That's because maybe guidelines have gotten looser or guidelines have tightened a little bit. So we need to make those changes. We promise we're going to communicate as much as we can, as often as early as we can, to let you know those changes, but please, I ask that you be flexible with us. Also related to some of the expectations when you show up on Sunday morning, masks are required of all volunteers throughout the entire morning. First, this is what we are asked to do. Second, I think it just models responsibility to our kids and families. So we are asking that all volunteers wear masks throughout the morning. Temperature checks, of course, are required of you. And like I said, in one of the training videos, this happens on Sunday morning as you're coming into the building. You don't have to stop anywhere to get your temperature checked. It's going to happen as you're walking in. We're asking that you help us out with cleaning as much as possible. Be mindful of that in the room, keeping things clean and wiping surfaces down as needed. There'll be cleaning supplies and all those things in the room for you to use. Sick policy, as part of this training, we're asking that you read through some of our policies and guidelines and also our sick policy. Ask that you be mindful of that. And if you notice anything with kids on the morning of that you're serving, that you let us know as fast as possible. But also, of course, if you are sick or not feeling well, that you communicate to us as early as possible. Comes to restrooms and water fountains. Our restrooms do need to be cleaned between each use. Asking that you kind of help with that a little bit. Again, we're trying to create a cleaning team that's going to help there so that you can spend the time in the classroom that you need, but just be mindful of that. And also just helping out as needed with that and being flexible in that area. Water fountains are closed down. We're not having any water fountains throughout the building. However, we will have bottles of water available for kids if they need it. Not really advertising that because every morning, every day, every kid will want a water bottle. But if it's needed, we have water bottles available, but we're shutting our water fountains down. Hand hygiene will be very important for us throughout the Sunday morning to create that clean, healthy environment for kids. So encourage that you help us in that you model that well, that you help preschool kids, elementary kids keep clean hands throughout the morning. So those are our expectations of what we're asking of you as you begin to volunteer back with us on site. Again, thank you so much for being a Plum Creek Kids volunteer. The reality is we could not do ministry without you. So thank you for what you do and how you make and help us partner with parents to impact the next generation for Christ.